Hi everyone, my name is Kodama. I'm a fourth year medical student and MD PhD student from UCSF. And I've had the privilege of doing a longitudinal sub-internship rotation with Dr. Selena Chan at the Osher Center. And today she invited me to share with you a bit of my own background and how I came to doing this rotation, as well as some of the learnings that I've gathered through my experience with Dr. Chan and her patients, as well as through the Osher Center. So kind of going back to the beginning, I was born in Columbus, Ohio, raised by Japanese immigrant parents and spent many summers also in Japan. So kind of straddling two different cultural worlds, spending most of the academic year in Ohio while also spending summers and some schooling in Japan. After high school, I then went to Johns Hopkins University, where I decided to study neuroscience and creative writing. Both of these subjects were ways for me to better understand people's perspectives through both a scientific and a humanitarian lens. And this is also the time when I became interested in becoming a physician scientist, trying to bridge the two worlds of both the clinical world as well as the research world. And so after graduating from Hopkins, I then joined the MD PhD program at UCSF and continued neuroscience research during the PhD years by joining Dr. Lee Gann's lab, trying to understand sex differences in Alzheimer's disease using mouse models. So the PhD years were really quite isolated from the clinical experience. So then going back to medical school to do my third and fourth year rotations was really a profound time to finally be able to meet the patients that I'd been really doing research about and getting to learn firsthand what their disease experience was like. And third year, I quickly found that I had a passion for psychiatry and decided that that's what I wanted to go into for residency. And so during my fourth year, I started this longitudinal rotation with Dr. Chan to learn more about psychiatry and how it's embedded into integrative medicine. There were a few things that I wanted to touch on during my third year medical school experience that I think really drew me to some of the philosophies and cultural aspects of integrative medicine that I didn't quite find in some of the experiences I had during my third year rotations. One of them was that I felt a little frustrated by the arbitrary categorizations of medicine and how the different subspecialties were quite siloed. I especially felt this to be true when we were looking at patient care from an individual patient perspective, where care was really very algorithmic. Patients were classified by distinct problems and problem lists that were supposedly supposed to have some kind of distinct solution, when in fact, many of the patient experiences were not able to be encapsulated by a problem list or did not have very fast and easy solutions. And I found that throughout my rotations, I was really drawn to clinicians who thought holistically about the patient, thought about their whole experience, not just in the inpatient setting where they were seeing the patient, but rather thinking about their values, their past experiences, their present needs, and also their future, and thinking about all of aspects of the patient, including how they fit into their own communities, what kind of family support did they have, and integrating all that information to then come up with the best clinical plan for that patient. And so being able to work with Dr. Chan and the Osher Center was a way to reconcile some of these frustrations that I felt during my third year rotation, where people really were thinking in whole person or whole system ways of caring for patients. People were okay with medical conditions that were not well understood or did not have very easy solutions, but would rather focus on the patient experience and their values and learn together with the patient about their experience to come up with an optimal clinical plan. And so being able to see that demonstrated through Dr. Chan and the Osher Center was really a healing process for myself as well after what I saw in some of the experiences I had during third year. And so some of the ways that I've been able to experience this was through Dr. Chan's planning of me being able to see and participate in grand rounds and case conferences, really seeing how other clinicians outside of psychiatry at the Osher Center are also providing care in a holistic manner, whether that be through physical therapy or acupuncture or meditation, and also like nutrition, thinking about diet, all these ways in that how the Osher Center was very interdisciplinary. I also really benefited a lot from the personal mentorship through Dr. Chan. We immediately connected, I think, from the first meeting, given both of our common backgrounds in growing up in two different kind of cultural worlds. And we discussed that quite a bit. And she also gave me a lot of guidance, especially through the residency application process, reading and editing my personal statements, and integrating our backgrounds together to kind of understand why we are drawn to psychiatry or why we are drawn to certain patients or certain styles of interviews. And then finally, of course, I've been learning a lot from the patient visits and the patients themselves. And Dr. Chan has really given me the space to lead the interviews and ask questions, and also gave me the time to reflect after each patient visit to talk about what went well, what feelings came up, what things could be improved, and what kind of strategies to use in the future for interviews. And so I'm really, really thankful for all the educational and mentorship that I've gotten through this experience. And I really want to thank you all for listening to this. And of course, a special thank you to Dr. Selena Chan, as well as the Osher Center and the rotation coordinators that made this happen.